Here's the number that broke me when I first saw it. The average American over 65 spends $7,030 a year out of pocket on healthcare. And that's with Medicare. That $586 a month gone before rent, food, or anything else. And Medicare doesn't travel with you. The moment you leave the US, it stops. But here's what the retirement industry doesn't want you doing the math on. Right now, in 7 countries, legal residents pay as little as $0 per doctor's visit, $0 for prescriptions, $0 for hospital stays, with English-speaking doctors, modern equipment, and no 3-month waiting list. The bill at the end isn't a typo, it's the system. We verified 7 countries where that $0 bill is real. How you qualify, what it actually covers, where the language barrier disappears, and, critically, where the catch is hiding. Because there's always a catch, and we're going to tell you exactly what it is before you book a flight. Counting down 7 to 1, stay until number 1. It's the country with the most comprehensive public healthcare system in the world that will enroll you for roughly the cost of a streaming subscription, and your doctor probably trained in the United States. Everything in this video was cross-referenced against International Living's 2026 healthcare rankings, the CEO World Magazine Healthcare Index, WHO Global Health Reports, official government health ministry portals, and active expat forums with first-hand 2025 to 2026 reports from Americans currently using these systems. In International Living's ranking of the top 5 healthcare systems for expats in 2026, the countries listed were France, Portugal, Spain, Panama, and Costa Rica. We went deeper. 7 countries, real numbers, real visa pathways, and the specific English language access situation in each one. Because GoCro, did you sound Rimamatosan? Do you want? Because Docros speak English means something very different in a rural clinic versus a JCI-accredited private hospital, and that difference matters enormously when you're the one on the table. Let's start with the myth bust. Spain is expensive now, if you're in Barcelona or Madrid, full stop. But move your radar south to the Costa del Sol, or west to Valencia, or out to the Canary Islands, Tenerife or Gran Canaria, and you're in a completely different economic reality. One that includes access to one of the finest public healthcare systems in Europe, entirely free once you're a legal resident, with English spoken widely enough in expat zones that you will never feel lost in a consultation. English-speaking doctors are not guaranteed, but they're more common in the private system and in areas with large expat populations. Madrid, Barcelona, Malaga, and along the Costa del Sol. In the Canary Islands specifically, where British and German expat communities have existed for decades, English is genuinely embedded in the healthcare infrastructure. Choose your location strategically, and the language barrier in a medical setting largely disappears. The public system, known as the Sistema Nacional de Salud, SINES, provides universal coverage to Spanish citizens and legal residents who contribute to Social Security. Spanish residents visiting the doctor do so without copays, 0, at the door. Spain non-lucrative visa, the NLV, requires proof of passive income of approximately 28,800 euros per year for a single applicant, or around 2,400 euros a month. That's the honest current threshold. Social Security plus a small pension or investment income typically clears it. Once you're a legal resident and contributing to the Social Security system, public healthcare access follows automatically. Many expats choose a private health insurance plan for shorter wait times and access to international hospitals, with policies starting at 40 euros monthly. Most expats use public for routine care and keep a low-cost private policy as a supplement for specialist access and shorter waits. Combined monthly costs for most retirees, $40 to $80 total. First, the NLV income threshold of €2,400 a month rules out Americans whose only income is a single small Social Security check. It's achievable, but requires your combined income to clear that line. Second, wait times can be long in either system, partly because doctors take more time with patients, and for non-urgent specialist referrals can stretch from several months to well over a year, especially in Lisbon and Porto. The same pattern holds in Spain's larger cities. In smaller towns and the Canary Islands, this is less severe. Third, Spain's cost of living in expat popular areas has risen meaningfully since 2022. This is not the bargain basement Spain of 2018. Budget, honestly. Europe's finest public healthcare at $0 per visit. If your income clears the NLV threshold and you choose your location smartly. The Costa del Sol and Canary Islands are where English access and healthcare quality converge best. But if the Spanish income threshold is too steep, number 6 has a lower bar, and a healthcare system that Americans inside it are describing as genuinely extraordinary. Portugal holds a unique position on this list because it offers two parallel healthcare worlds. A public SNS system that legal residents can access free or near free, and a private sector with English-speaking doctors that is so affordable it almost doesn't matter which one you use. Portugal is popular with retirees because local healthcare costs tend to remain manageable on fixed incomes. Most of the doctors seen by expats speak English, especially in the private sector, and the quality of care is outstanding. One American expat who moved to Portugal described receiving more thorough preventive care there than she had received in years in the United States. Doctors ordered tests she'd never heard of, and others she'd been requesting for years back in the US. She was finally given a colonoscopy, denied to her in the US despite being in her mid-50s, and a DEXA scan that revealed severe osteoporosis. Imaging is provided in hard copy and also accessible through a patient portal, and doctors take the time to explain the results clearly in English. Expats can find and see English-speaking doctors within the private medical system without insurance for about $65 to $160 per visit. With insurance, this cost is usually knocked down to under $25. Private insurance in Portugal averages around $150 per month and is comparable to what coverage was in the US. But covers travel outside of Portugal too. And the public SNS? Once registered, appointments are free or carry a nominal copay of €5 to €8. Medication prescribed through the national healthcare system costs a fraction of private price. One expat's medication went from €250 every 6 months to just €60 with national healthcare coverage. Portugal's D7 passive income visa requires approximately €760 to €1,000 per month in verifiable passive income. Pension, Social Security, rental income, dividends. The average Social Security check of $1,900 clears this comfortably. Once on the D7, you establish residency, register with the local SNS health center, and access public health care. First, many expats keep private cover specifically to skip SNS waiting lists, which for non-urgent specialist referrals can stretch from several months to well over a year, especially in Lisbon and Porto. The public system is real, but for specialist care, plan on carrying a private supplement. Second, Portugal's Immigration Authority, AIMA, has been processing D7 applications extremely slowly in 2025 and 2026. Applicants are reporting 6 to 12-month waits. You need a local immigration lawyer and patience as a genuine budget item. Third, Portugal's NHR tax deal for retirees, the one every older video raves about, is dead. Closed to new retirees in early 2025. Go in knowing the tax picture changed completely, and hire a cross-border accountant before you move. Private healthcare in English for under $25 a visit with insurance, public healthcare for near zero, and a cost of living that keeps your overall monthly spend inside $1,800. Portugal is extraordinarily functional if you hire the right professionals to navigate the paperwork. But if you want zero language barrier in a medical setting, not mostly English, zero language barrier, combined with a public healthcare system ranked #1 in the world by one of the most credible indexes on the planet, we have to go to number 5. According to CEO World Magazine's Healthcare Index in 2024, Taiwan has the best healthcare system in the world. Number 1. Not top 5, number 1. And here's the part that makes this genuinely extraordinary for American retirees. Legal residents, including foreigners, are enrolled into the same system that Taiwanese citizens use. The same hospitals, the same doctors, the same coverage, for roughly $42 a month in premiums. Most Americans think Taiwan and immediately think geopolitical tension. The China situation, the Taiwan Strait, that's a real consideration we'll address honestly. But the Americans who have actually moved there describe a country with Costco, English language everything in the cities, American chain restaurants, a deep cultural familiarity with the United States built over decades, and a healthcare system so efficient it operates like a different civilization compared to what they left behind. Unlike other Asian countries, the system is fast, efficient, and affordable. You can see a doctor quickly. Hospitals and clinics are modern, and most doctors are well-trained. Many of them speak English, especially in big cities. International departments at major hospitals conduct consultations entirely in English. Outside of major cities, Tainan, Taichung, English is less universal, but still present in hospital settings. 56 million residents and foreigners with a valid alien resident certificate, ARC-Brechnikis, are required to join once they meet the eligibility rules. Every Taiwanese citizen with household registration or foreign national living in Taiwan with an alien resident certificate, regardless of age, gender, or employment status, must enroll in the program. The average premium is roughly $42 per month across the insured population. For that $42, you get access to hospitals, specialists, surgery, prescription drugs, dental care, all covered. Co-payments remain modest, about 100 NTD, roughly $3, for an outpatient visit and 4,700 NTD, roughly $140, for inpatient care, with an annual safety cap, a $3 copay, at a world-class hospital, with an English-speaking doctor. Dental and traditional Chinese medicine are covered, with dedicated budget allocations in the 2026 budget. This is not a stripped-down public system. This is comprehensive. ARC holders without an employer, dependents, retirees, must enroll after a continuous 6 months of residence in Taiwan. 6 months before you're in the NHI. During those 6 months, you pay out of pocket or carry travel insurance. After that, you're inside the system. Taiwan. The geopolitical situation is real and it deserves a direct answer, not a dismissal. Cross-strait tensions with China have escalated meaningfully since 2022. The U.S. State Department does not currently advise against travel or residency in Taiwan, but it does acknowledge the situation as one to monitor. Thousands of Americans live in Taiwan today and have no intention of leaving. But if you are the kind of person who would lie awake at night worrying about geopolitical risk, that anxiety is legitimate and Taiwan may not be the right fit regardless of how extraordinary the healthcare is. Go in with clear eyes. Second catch. The 6-month NHI waiting period is a real gap. You need a plan for that gap, either savings or interim insurance. Third, Taiwan's Gold Card, the main long-term residency pathway for non-working retirees, has specific income or professional qualification requirements that not everyone meets. A Taiwan-based immigration consultant is essential before you plan a move. The #1 ranked healthcare system on Earth, for $42 a month in premiums and a $3 copay. If the geopolitical context doesn't rule it out for you, nothing on this list competes on pure healthcare value. But if you want a system where you walk into a public hospital as a legal resident and your bill at the end is genuinely, formally, structurally, zero, and your doctor was likely trained in the United States, number 4 is the one that changes how you think about this conversation entirely. Costa Rica is the country that makes American healthcare look like a scam by comparison. And that's not hyperbole, it's arithmetic. One of Costa Rica's biggest draws for expats is that private healthcare is 50 to 70% cheaper than in the United States, even without insurance, and that's the private system. The public system, CAJA, costs you $0 per appointment once you're enrolled. Zero. With nearly 200 doctors in dozens of specialties, CEMA Hospital became the favorite hospital of American expats soon after it opened in 2000. CEMA, which stands for Centro Internacional de Medicina, is owned by the International Hospital Corporation of Dallas, Texas, and is affiliated with Baylor University Medical Center. There is a U.S.-owned, Baylor-affiliated hospital in Costa Rica. Let that sink in. And the bill there is 50 to 70% cheaper than what you'd pay at a comparable U.S. facility. Most of the doctors in private establishments communicate in English as they are trained in top medical colleges in the U.S. and Europe. So many Panamanian doctors study abroad and speak English that this is a very comfortable place to land, even if you don't speak Spanish, and that applies to dentists and specialists as well as general MDs. In the CAJA public system, English is less universal. You will encounter Spanish-only staff in some CAJA clinics. But in the private hospitals and the EBAIS clinics in expat-dense areas of the Central Valley, English is consistently present. The CAJA Costarricense de Seguro Social, universally called La CAJA, is Costa Rica's universal public healthcare system. Established in the 1940s, it operates 29 public hospitals and over 250 clinics nationwide. Every legal resident, temporary or permanent, is required to enroll and contribute. And once enrolled, all costs are covered for those enrolled in the CAJA system. Patients do not have to pay anything for their appointments. Not a copay, not a processing fee, zero. Your monthly CAJA payment is not a flat fee. It is calculated as a percentage of the income you declared on your residency application, typically ranging from 7% to 11%. On a $1,500 monthly income, that's roughly $105 to $165 a month. On a $2,000 monthly income, $140 to $220, that's your total healthcare bill. In exchange for that monthly contribution, complete coverage for all medical procedures along with prescription drugs. An example of the advantage of the Costa Rican public healthcare system, pre-existing conditions are covered. You read that correctly. Pre-existing conditions covered from enrollment. In Costa Rica, the public and private healthcare systems work well together. Many Costa Rican doctors work in the mornings for CAJA and have their own private clinic office hours in the afternoons and evenings. Many expats embrace this mix of public and private, so the medicines they prescribe can be obtained from CAJA pharmacies for free. That's the actual system in practice. See your CAJA doctor, get a private consultation for speed when needed, fill the prescription for free at the CAJA pharmacy. Mature, efficient, and built for exactly the kind of patient an American retiree is. Costa Rica's Pensionado Visa, the retirement visa, requires a minimum monthly pension income of $1,000 from a guaranteed lifetime source. Social Security, pension, annuity. The average Social Security check is $1,900. This is achievable. The Rentista visa requires $2,500 per month in guaranteed income. CAJA enrollment is mandatory and happens as part of the residency process. It's not optional, and it's not a sidestep. It is the system. Temporary residence CAJA costs range from $50 to $400 per month depending on visa category. Permanent residents pay as little as $45 per month per family, making it one of the most affordable healthcare options in the world. First, CAJA public healthcare drawbacks include potentially long waiting times for non-emergency cases, difficulties finding English-speaking medical staff, or potentially limited selection for practitioners and specialists. CAJA wait times for non-urgent specialist referrals can run weeks to months. Most expats solve this by keeping a small private insurance supplement. Second, the INS private health insurance is not available for expats over the age of 70. If you're 71 or older, your private supplement options narrow, international insurance companies become your route, and premiums for 70 plus are meaningfully higher. Budget for this. Third, Costa Rica is not as cheap as it was 5 years ago. The Central Valley, Escazú, Santa Ana, San Jose suburbs now carries price tags that approach Portuguese levels. The Southern Zone and Guanacaste still offer genuine value, but if you've seen a budget breakdown from 2019, reprice everything. Pre-existing conditions covered, $0 per appointment, English-speaking doctors trained in the U.S., a Baylor-affiliated private hospital as your backup, and a retirement visa that $1,000 a month of guaranteed income qualifies you for. Costa Rica's CAJA system is the most complete public healthcare deal available to American retirees in the Western Hemisphere. But the next three countries take the concept of English language access to another level entirely, because in these places, English isn't a feature you have to seek out. It's the operating language of the medical system itself. Panama City has a district so medically dense, so internationally accredited, and so explicitly English operated that expats call it the medical corridor. Hospitals like Paitilla, San Fernando, and Pacifica Salud sit within blocks of each other. These top-notch hospitals are affordable, modern, and incredibly efficient, many affiliated with distinguished organizations like Joint Commission International or Cleveland Clinic. So many Panamanian doctors study abroad and speak English that this is a very comfortable place to land even if you don't speak Spanish. And that applies to dentists and specialists as well as general MDs. This is structural, not incidental. Panamanian medical education has deep U.S. ties. Many Panama City doctors did their residencies in American hospitals. The consultation in English isn't a lucky find, it's the standard. Panama City, English-speaking doctors are essentially the default in the private medical corridor. Boquete in the Chiriquí Highlands, the large English-speaking expat community, has created genuine demand. You can find English-speaking doctors locally. Coastal beach towns like Padasi or Coronado, more Spanish-dominant though increasing numbers of bilingual practitioners are establishing practices as expat populations grow. Medical care in Panama is often available at a fraction of U.S. prices, with a strong expat infrastructure and English-speaking medical professionals. A specialist consultation at a top Panama City private hospital, $40 to $80. An MRI, $200 to $350. A crown at the dentist. One expat paid $580 for a crown replacement, a procedure that costs $1,000 to $3,500 in the States. Now here's the Pensionado discount program. And this is where Panama does something no other country on this list does. Panama's Pensionado visa, which requires just $1,000 a month in guaranteed lifetime pension income, comes with legally mandated discounts specifically for visa holders. 20% off medical consultations, 15% off hospital bills, 10% off prescription medication, and 20% off medical procedures. These are written into Panamanian law. Your pensionado card is literally a medical discount card backed by legislation. First, Panama's public hospital system is a different story from the private corridor. There are public hospitals in Panama City and other hub towns, but most expats prefer not to use them. Those facilities often come with longer wait times, so it's best to leave available slots for low-income Panamanians who can't afford private care. The Great Gurgurg $0 bill here applies when you're using private care with your pensionado discounts, not a public system enrollment. Your bill after discounts is not zero, but it's dramatically lower than the US equivalent. Budget for private care or carry international insurance. Second, outside Panama City, English-speaking doctors become less consistent. Boquete is fine, truly remote areas are not. Third, for serious complex procedures, cardiac surgery, oncology, transplants, most expats travel to Panama City or back to the US. Have a plan and have coverage. JCI-accredited hospitals, English-speaking doctors trained in US residency programs, legally mandated discounts tied to your retirement visa, and a cost of care that makes even a private bill feel manageable. Panama's private healthcare is the most structurally English-friendly system in Latin America. But if you want public healthcare that's free at the point of use, English that's genuinely the operating language of everyday life, and one of the most expat-welcoming medical cultures on this entire list, the next two countries are where this conversation gets extraordinary. Malaysia has something no other country on this list has in quite the same form: a healthcare system with state-of-the-art facilities in public and private hospitals and highly trained physicians, many of them from the UK or Australia. Foreign physicians can practice without restriction, especially if they have high qualifications and degrees. So it's not difficult to find a first-rate physician who speaks English or other languages. Malaysia was a British colony, and English is a co-official language of government, business, law, and education. The question almost doesn't make sense, because English is the medium of operation. Gleneagles Penang, Penang Adventist Hospital, Island Hospital, these are JCI-accredited international medical facilities where English is the working language, full stop. Private hospitals have English-speaking and sometimes French-speaking staff. Hospitals like Gleneagles, Kuala Lumpur, Pantai Hospital, Sunway Medical Center, and Prince Court are well-equipped, JCI-accredited, and English-speaking. Waiting times are short. Same-day specialist appointments are normal. Not a 3-week wait. Same day. Here is where the, quote, medical paradise label is fully earned. A specialist consultation costs MYR $100 to $300, around $22 to $65. A hospital stay at private facilities runs MYR $450 to $1,800 per day, around $100 to $400. Compare that to the US, where a single hospital night averages over $2,800 before insurance adjustments. Malaysia's healthcare is excellent and English-friendly, but foreigners skip the subsidized public rates Malaysians pay. Since July 2025, and now fully enforced in 2026, private healthcare for non-citizens is subject to a 6% sales and service tax that Malaysian citizens do not pay. That reshapes the usual public versus private choice. The public route is no longer the cheap fallback it was for locals, and the private route adds 6% on top of an already higher foreigner bill. This is the honest 2026 picture. Malaysia's healthcare for expats is not $0 at the door. It is extraordinarily affordable by US standards, but it is not the free public system you get in Spain, Portugal, or Costa Rica. The value proposition is world-class private care, English-speaking specialists, same-day appointments, JCI accreditation, for $22 to $65 per consultation. That's the deal. And it's a remarkable deal. An individual international health insurance plan in Malaysia runs around $414 per month in 2025 at the premium tier. However, local Malaysian private insurance from providers like AIA Malaysia or Great Eastern runs significantly lower, from MYR 100 to 500 per month, approximately $22 to $110, depending on age, coverage level, and whether it includes global benefits. For a healthy 62-year-old, a local plan with solid hospitalization coverage typically runs $80 to $150 a month. First, the new 6% SST on private healthcare for non-citizens adds up. The 6% SST has not pushed expats back toward the public system. Malaysia's finance ministry reported in 2026 that private hospitals in Penang, Johor, and the Klang Valley still see strong foreign patient numbers, and expats mostly treat the tax as a minor line item. But it should be in your budget. Second, most local Malaysian insurers won't accept new customers over 60 or 70. If you arrive at 68, your local insurance options narrow, and international plans become necessary at higher premiums. Third, Malaysia's MM2H long-term residency program was overhauled in 2021, and the premium tier financial requirements rose substantially. RM 40,000 per month in offshore income at the standard tier, which most retirees cannot clear. The Penang State PMM2H program has its own requirements. An immigration lawyer on the ground is essential. Fourth, the heat. Penang averages 85 to 92 degrees Fahrenheit with high humidity year-round. For anyone with cardiovascular conditions, this is a real medical consideration that needs a doctor's clearance first. JCI-accredited hospitals, same-day specialist appointments, English as the operating language of the private medical system, and consultation fees of $22 to $65. Malaysia's private healthcare is the most accessible English-language medical system in Southeast Asia for Americans who want quality, speed, and predictable costs. And then there's number one. The country that lands at the top of this list because it does something no other country here does. It gives you access to a fully functional, broadly comprehensive public healthcare system in a country where English is not just spoken, it is the first language of medicine, for a monthly premium that costs less than most Americans pay for a gym membership they don't use. Here's the statement that will stop you. Malta is an EU country where English is the first language of medicine, not the second, not a courtesy, the first. Where legal residents access public healthcare at zero cost, where private specialist consultations run $30 to $50, and where the healthcare system is ranked in the top 10 in Europe by the World Health Organization. And almost nobody on any retirement YouTube channel is talking about it seriously. Every other country on this list has a language layer you navigate. Spain, Spanish-dominant outside expat zones. Portugal, English in the private sector, Portuguese in public clinics. Costa Rica, Spanish in CAJA clinics. Panama, English in the medical corridor, Spanish everywhere else. Malaysia, English in private hospitals, Malay in public ones. Taiwan, English in major hospital international departments, Mandarin everywhere else. Malta, English is an official language, a co-official language alongside Maltese, embedded in the country since it was a British colony for 164 years. Your doctor's first language, in many cases, is English. Your medical chart is written in English. Your discharge papers are in English. Your prescription is in English. You never navigate a language barrier in a Maltese hospital, ever. Malta consistently makes top 10 lists for healthcare across European comparisons. Mater Dei Hospital in Valletta is a modern, fully equipped public hospital with specialist departments covering everything from cardiology to oncology. It was built in 2007 and serves as the country's flagship medical center, and as a legal resident of Malta, you access it under the same terms as a Maltese citizen, with government health contributions rather than per-visit billing. Malta operates a public healthcare system funded through national insurance contributions. Legal residents, including those on Malta's retirement-friendly residency programs, are enrolled in the system and pay national insurance contributions based on their income level rather than flat fees. Routine GP visits under the public system free. Specialist referrals through public hospitals free. Emergency care free. Prescription medications for chronic conditions heavily subsidized or free for qualifying residents. The private healthcare system in Malta runs in parallel. Private consultations typically cost $25 to $40 at private clinics, St. James Hospital and Capua Palace in Slima being the main private English-language facilities. Specialist consultation, $50 to $90. An MRI at a private facility, $180 to $280. Dental care. Comprehensive private dental treatment in Malta runs 60 to 70% below comparable UK prices, which are already far below US costs. There is no other country on this list where you can walk into a rural GP clinic, a hospital emergency room, a specialist's office, or a pharmacy, anywhere, and conduct your entire medical interaction in English without a translator, without a medical phrasebook, and without hoping your doctor's English is good enough. In Malta, it always is, because it's their language too. Malta's Global Residence Program, the GRP, is the main pathway for non-EU retirees. It requires a minimum annual tax payment of €15,000, proof of health insurance coverage at application, and a rental or purchase of property meeting minimum thresholds. The Gozo version of the GRP carries a reduced minimum tax of €10,000 annually. Malta's retirement program, specifically for pensioners. Taxes qualifying foreign pension income at a flat 15%, with a minimum annual tax payment of €7,500. These are the honest current numbers. Gozo, Malta's smaller sister island, 25 minutes by ferry from the Maltese mainland, offers lower rents, a quieter pace, and access to the Gozo General Hospital for routine care, with ferry access to Mater Dei for specialist needs. A furnished one-bedroom in Gozo, $400 to $650 a month. In Slima or St. Julian's on the Maltese mainland, $700 to $1,100. For a budget of $1,800 a month total, Gozo is the choice that leaves genuine breathing room. First, Malta is small, 316 square kilometers, and it is being discovered. Rental prices, particularly in Slima, St. Julian's, and Valletta, have risen significantly since 2021, driven by an influx of European remote workers. The window where $700 gets you a good one-bedroom in Slima is narrowing. Gozo remains affordable for now, but even Gozo's prices are trending up. Move sooner, not later. Second, the GRP requires proof of health insurance at application, meaning you need to carry private coverage during the visa process before public enrollment kicks in. Budget $100 to $200 per month for a bridging policy. Third, Malta's small size means limited specialist options domestically. For very high complexity procedures, rare cancers, complex cardiac interventions, the standard pathway is referral to a specialist in the UK or mainland Europe, partially reimbursed. Plan accordingly. English as the first language of medicine, not a second language, the first. Public health care at $0 per visit once enrolled as a legal resident. Private specialist consultations at $30 to $50. A modern EU country inside the Mediterranean, ranked top 10 in Europe for healthcare quality, where your entire retirement budget, including healthcare, can fit inside $1,800 a month in Gozo with money left over. Nothing on this list delivers the combination of zero language barrier, zero cost public care, and European quality simultaneously. Malta is number one, and it's not close.